Green and washed.
Okay, good morning, everybody, and you're very welcome to this morning's seminar from the Equality Commission. My name is Paul Oakes from the Advice and Compliance Division, and I'm going to host the event for you this morning.
Your mic's cut out.
From our perspective, today's seminar has two principal aims. First of all, we want to help increase employers' awareness of the issues around promoting good mental health and well-being in the workplace. And secondly, we want to encourage and facilitate employers in developing policies and practices and procedures to help them better address mental health and well-being in the workplace, and to indeed offer them support in doing that at a practical level. I will go through the agenda in a few moments, but firstly, I would just like to deal with some technical issues because, as you will be aware, our technology is new and it has its own idiosyncrasies at times, as I've discovered this morning. So in terms of the technology, if you have an issue with connectivity, the best thing to do is to go back to your link and try and rejoin. That will usually resolve the problem. Secondly, there is a questions and answer function, and you will see that on the screen, and you can ask questions using that function. What we propose to do is, after each speaker, we will have a questions and answer session. So as the speaker is going through the presentation, the best thing for you to do then is to note your questions in the questions and answers function, and some of my colleagues will collate them, and then I'll be able to present them to the speaker. Okay. In terms of our speakers, we have a range of speakers today, and in terms of the event and the agenda, you'll see that we begin with the Chief Commissioner of our own organisation, Geraldine McGahey, and then we have Siobhan O'Neill, who's the interim mental health champion in Northern Ireland, and we then have Mark H. Durkin, MLA, who is the chair of the Assembly All-Party Group dealing with mental well-being. And those three presenters will examine the issue of mental health and well-being from a strategic perspective, and examine it as a strategic policy issue and a strategic priority for government. And it will be an overview of those particular type of issues. And then when we move on to the second group of speakers, they will be giving more of a hands-on practical examination of how to promote mental well-being in the workplace. So the groups of speakers link together very nicely. And amongst those speakers, we have Claire Kelly from Health and Safety Executive, who I will introduce at that time when she is about to speak. We'll then have Edith Dunlop from the Northern Ireland Union for Supported Employment. And finally, we will have my own colleague, Una Wilson, from the Equality Commission. And I would also say at this stage as well, we'll be emphasising the need for you to fill in the evaluation form at the end, so that we can put together an assessment of how well it's gone and how we can improve things. And that's your opportunity also to tell us whether we can provide you with additional support and advice in relation to this issue. So to begin today's event, our first three speakers, Geraldine, Siobhan, Mark, their presentations are conducted through a series of videos, which we will now show you. And then we will move on to our next speaker, Claire, who will be live. So let's begin with the video presentation, and we hope you enjoy it and found it useful.
Hello and welcome to this Promoting Mental Health at Work webinar. This event is very timely given the immensely stressful time that we all live in, but it also marks the UN International Day of Persons with Disabilities for 2020. Regardless of whether you're an employee or an employer, the management of mental health issues in the workplace is a very real problem. It's one of the highest causes of sickness absence in the workplace for employers. If any illness has a significant adverse and long-term impact on a person's ability to carry out normal day-to-day activities, it's likely they are protected under disability discrimination law. Mental illness is the leading cause of disability in the UK, and rates in Northern Ireland are significantly higher than any other region, at least 25% higher than there is in England. It's no wonder that employers are concerned. Up until March of this year, in the pre-COVID era, if any of us can remember those times, our advice and compliance team was fielding many queries about the management of mental ill health in the workplace, about how to safeguard employees and how to build resilience. Many employers see these issues as a legal minefield because of the discrimination protections that are afforded. Getting it wrong can add to the mental anguish felt by employees and potentially claims of discrimination, with the ensuing grievances, tribunal actions, and other potentially serious ramifications. It's no wonder that our events on this subject were always hugely popular. Back in the day when we could all meet together, these events were packed with hundreds of employers and HR people keen to learn more. The Equality Commission is here to help. We're not just here to assist people who have been potentially discriminated against. Yes, that is a key role for us, to challenge discrimination by giving advice and information to people and supporting some cases to court or tribunal. However, an equally important aspect of our role is to promote equality by working with you, the employers, to avoid potential discrimination cases, to improve your workplaces and your policies. We don't yet know exactly the impact that COVID is going to have on our employees, but we do know that it has given employers massive additional problems. On top of employees' fears about job security, the furlough scheme and the changing landscape of job protection, there are founded fears about returning to the workplace, using public transport, lack of childcare, and of course money worries. Some find working from home a strain. Where did our work-life balance go? Many are working longer or irregular hours, having to combine working from home with homeschooling, or indeed caring for other family members, or just simply missing human interaction. And how many of us managers have forgotten about the respect for time boundaries, for example? Do we contact our employees at unreasonable hours? Undoubtedly, lockdown and social restrictions, along with isolation, fears about contracting the virus, anxiety about family and friends, can prey on everybody's mind. On top of all that, some may have suffered bereavements, even without the chance to say goodbye. In relation to mental ill health, the Chartered Institute of Personnel and Development has found that employees were reporting reduced motivation, loss of purpose and motivation, anxiety and isolation, with symptoms ranging from irritability, anger, depression, and post-traumatic stress symptoms. Mental health issues are not helped by other health matters, but they're added to by reduced exercise and even potentially increased alcohol consumption. Similarly, the mental health charity Mind has found that more than half of adults and over 2/3 of young people said their mental health has got worse over lockdown. And let's not forget, these worries and anxieties apply to you too as employers, as business owners and managers. Many of you are undergoing great strain, trying to keep businesses afloat, perhaps having to radically change an established business, or even make valued staff members redundant. You need to be mindful of your own mental health and well-being. So what should employers do? The fact that you're here today, that you're listening to me, is a great start. Talking to other people in your situation, asking for advice, reading, listening, can all help you forge a way through this. Whilst reducing sickness absence in the workplace due to mental ill health in a way that is free from discrimination is vitally important to employers, many employers have done so much more. Great efforts have been made to protect the physical health and safety of our employees. It's now time to put similar efforts into protecting and safeguarding their mental well-being. It's just as important. And this is where the Mental Health Charter comes to the fore. Around 200 employers from across the private and public sectors have already signed up to it, and they are starting to see the benefits for themselves and their employees. The Commission and all our partners in the Mental Health Charter initiative have a wealth of advice and information to share with you. It's free, it's confidential, so please ask us or use the website. Today is not just about learning or hearing about the ongoing initiatives to help address mental ill health. It's about how all of us can support mental well-being, to hear about the support available, to build networks, and most importantly, to learn from each other. So thank you for coming today. Thank you for joining us, and I hope you get great benefit from it. Thank you very much.
Okay, hello, my name is Siobhan O'Neill. I'm the Interim Mental Health Champion for Northern Ireland, and I'm delighted to be here today to talk to you about mental health and wellbeing. I'm going to start by just going through a couple of aspects of my job and that you know what my role is. So my role is funded throughout all of the government departments, which is good because I can then influence all of those departments, because all of the departments have a role to play in maintaining mental health and wellbeing, and all the policies are relevant to mental health and wellbeing. I'm also a public advocate, so I represent people with lived experience in their carers, lived experience of mental health problems, and then also people and groups who work on the ground supporting others with mental health conditions and promoting mental wellbeing in other groups. And then finally, I am that network hub participating in the public discussion about mental health and wellbeing and getting out key messages there from the government. And I suppose it's particularly relevant that we're here during a pandemic when mental health and wellbeing is top of the agenda too. So as employers, it's important to recognise that the pandemic has brought a range of challenges to yourselves and to your employees. We're tasked with keeping ourselves safe, and there's a lot of fear, and we're also thinking about others and worrying about them. And if any of us have got infected with COVID, that brings a range of mental health issues as well, including stigma and the mental health impact of being ill. And all of those are significant. In addition to that, we're asked to maintain that physical distancing, and we have a loss of contact and community and connection that, as a result of what's happening right now. So the things that we would ordinarily do to support our mental health, many of those things aren't available to us, and we're managing different changes to our routines and isolation. And of course the uncertainty about the future. So you're dealing with all of those and also trying to run a workplace and a business, and that can be really difficult. So what can we do? What can we do to get some control over the situation and to support everyone's mental health and wellbeing? Well, it's important as employers to recognise that essentially we are pack animals and that you're pack leaders. So you need to view yourselves as pack leaders. And of course that means that you need to practice self-care, and you need to be a model of those self-care behaviours that you're expecting other people to engage in to protect their mental health. So that means that whenever you're engaging with your staff, you need to be calm and well regulated. It's important that you're not acting from a place of stress and anxiety. anxiety, and to recognise when you're in that place, because that's not a good place from which to problem solve and support other people. So my first message would be that calm is contagious. So you need to be that model of calmness and get yourself into that place. It's absolutely normal and natural to feel anxious right now. It doesn't mean that you have a mental illness, but it does mean that you need to try and adjust away from that in order to do your job really well. It's important to seek support if that's necessary as well, and help other people seek support and ask for help. We know that there are people who are developing additional difficulties right now, and some people are developing mental health problems for the first time and they have difficulty asking for help. So it's important that if you're in a position and you recognise that you can support other people to get help. It's also vital that you promote hope and have that hopeful attitude yourself. There's so much to be optimistic about right now, so it's important that you give that to your staff. Problem solving is something that we're needing to do a lot of right now, and again, helping people plan and solve and problem solve is a vital part of your role. But of course, it's important before we even start to problem solve that we validate those experiences and emotional impacts that we're hearing about. So being there for someone, listening, is really, really important, and then we need to calmly try and problem solve with them. It's also important that you yourself do things that give you pleasure, and that you have used that as an example for other people as well, so that again that you're modelling the kind of self-awareness and self-regulation and support that you want other people to engage into. So thanks for all of the work that you're doing right now to bring us through this really difficult time, and keep yourselves safe and well.
Hello, my name is Mark H. Durkin. I'm an SDLP MLA and I'm the chair of the all-party group on mental health in Stormont. I've always had an interest in mental health, and I have to say in many ways I'm glad to see how this issue has risen to the fore over the past number of years. More and more people are recognising the importance of good mental health and the dangers of poor mental health, not just to individuals but to society as a whole. And while the government have a lot of challenges as regards mental health, we're seeing waiting lists spiral, we're seeing demand for services increase. I take some heart from the fact that the stigma that sadly existed around poor mental health for so many years seems to be being chipped away. More people feel more comfortable to let people know how they're feeling, to let people know how it's affecting them, and hopefully, ultimately, to seek the help that they need to get back on the right road again. But while government has challenges, I think we all have a role to play, not only in protecting our own mental well-being, but also in looking out for others. That's why I was very interested in 2016 to attend the launch of the Commission's Charter, which was aimed at employers and recognising the important role that they have to play in terms of looking out for the welfare and well-being of their staff. It's great now that over 200 companies have signed up. I think it's very important in that they can look, they can see if people aren't well, that the support is there to help them identify the signs that people might be struggling, but also there to help them signpost those colleagues, those workmates, those friends to agencies and organisations that can help. The last 9 months has seen things change immeasurably in terms of how we work. Many of us are now working from home, myself included, and that throws up a whole lot of new challenges. We're struggling to cope with new ways of working. I'm having to deal with technology like this that wouldn't be my forte by any means. We're having to struggle and juggle with children. It's not just a case of entertaining them. At many junctures over the past 9 or 10 months, we've also been responsible for educating them. Now, this would be difficult at the best of times, and I think it's fair enough to say that these aren't the best of times. It's difficult to think of many worse times. There's a pervading sense of doom and gloom out there. There's an awful lot of uncertainty and an awful lot of anxiety. So the Charter and what it enshrined in workplaces in terms of looking out for each other and how to spot when someone's not well. It's much more difficult to do that when you're not seeing someone in the office every day. But I don't think that should detract from the responsibility that companies have, the responsibilities that we all have to reach out to our colleagues, to reach out and to check in, to ask them if they're okay, to follow that up and ensure that they are okay, to make people know that their work is valued, and also to recognise the difficulty that they're possibly having adapting to this new way of working and the other anxiety that they might have. But this works sort of both ways too. I don't think this should all fall on one person in each company to do, because that's an awful lot of responsibility, and that person will be struggling just the same as the rest of us. Like it said at the start, there's a collective responsibility here. We have to look after ourselves and we have to look out for each other.
Well, we hope that you found those presentations informative, and they were important to us to have today because we wanted to put the issue of mental health in a broader strategic context, and to show that this is an issue that is at the heart of government and is at the heart of government policy, and that it should inform employers when they're developing their own strategies to address mental health in the workplace. And it's interesting, Mark mentioned, as did Geraldine, the Charter. And the Charter was developed not just by the Equality Commission, but by all of our stakeholder and colleague organisations, because we were receiving lots of questions from employers about how to manage mental health in the workplace, really difficult challenges that they were struggling with. And we decided in conjunction with our partners that we had to do something to help employers, so that the Charter was the way of doing that. And my colleague Una will then go into some more detail about the support that signing up to the Charter offers you. But interestingly, one of those partner organisations is the Health and Safety Executive, and that's where we're going next to talk to Claire Kelly from the Health and Safety Executive from Northern Ireland, who's going to look at mental health and well-being, and to look at the experience of the executive, and to look at the proactive work that they've undertaken in relation to mental health in the workplace. So I'm delighted to introduce Claire, and Claire will be talking to us for the next 10 minutes or so. If you have any questions for Claire as we go through the presentation, please use the questions and answers function, and we can put your question to Claire at the end of our presentation. So Claire, you're very welcome to today's session. We're delighted that you're attending, and we look forward to hearing what you have to tell us today.
Thank you, Paul. Again, I'm delighted to be asked to speak here today and to listen to some of the range of speakers that you have invited here today. I think we've already heard some very important messages from Geraldine and from Professor Siobhan O'Neill and Mark Durkin, and even around the pandemic and the issues that has bring, because some of these issues may end up coming into the workplace, and that's where employers will have to be dealing with some of the issues. Today, I would like to just tell everyone a little bit about the approach that the Health and Safety Executive take in promoting mental health and well-being in the workplace. And I know you have mentioned again about the practical application. So one of the practical applications we would be promoting in the Health and Safety Executive, I'm going to talk to everyone today just a little bit about that. I suppose I'll tell you a wee bit about my own role. My own role as a mental wellbeing at work advisor is to really provide advice and guidance and that practical help to employers in both the public and private sector, and how to reduce and how to eliminate and control stress within the workplace. So the Mental Wellbeing at Work Advisory Service have actively worked with a number of and a range of employers, both in the public and private sector, and we have worked along with the Equality Commission as well. And we're currently working with the Commission to try and gather some good practice examples as well. So we're working with our stakeholders. One of the main areas of work that we deal with in the advisory service is how the issue of work-related stress is dealt with and how it can be effectively managed by using what we call the HSE management standards approach. And I'm going to talk a wee bit about that. I think we can all understand, and I'm sure we all recognise, that stress can hit anyone at any level of the organisation or business. And I know we heard some statistics there this morning from Geraldine, but research also shows that work-related stress is widespread. It's not just confined to particular sectors or jobs or industries. And the approach that I will be telling you about can be applied to any industry. Stress isn't an illness, it's a state. But if it becomes excessive and it becomes prolonged, mental and physical illnesses may develop in individuals, and then maybe that be having to be dealt with as well within the workplace. So you might be asking why you should manage stress. And again, I think a lot of organisations already know that there are obviously the legal reasons, the moral reasons, and financial reasons why we should be managing stress within the workplace. But it's important to realise that everyone has a part to play in this at every level of the organisation. I'm not going to go on obviously to too much details about today in the short space of time we have, but I just wanted to mention that with regards to the legislation, there's no specific piece of legislation that mentions or cites work-related stress. But the primary piece of legislation that underpins all the health and safety is, of course, the Health and Safety at Work Northern Ireland Order. And that really places a duty of care on employers towards the health, safety and welfare of all their employees. And then again, we have the Management of Health and Safety at Work regulations. And again, that places a duty on employers to carry out risk assessment. And the fact that risk assessment, and if you've already mentioned this morning, should not only cover those physical hazards, but it also should cover health hazards, including risk to mental health. So it's very important that organisations would understand that. And then where that is also supported is by what I already mentioned with the HSE management standards approach. And these are a set of principles that are designed to help employers comply with the law. They're a best practice approach. They're maybe not the only way to do it, but we actually, the HSE have developed these back in 2004. And really, it's known as a primary preventative intervention, a preventative tool for managing the risks to employees that they have from work-related stress. So it's very, very important to recognise that as well. So I'd like to just tell you a little bit about that methodology this morning and how you can use it in your organisation, and as well how we in the Health and Safety Executive can actually assist with that. So really, if you want to think of it like a project, as with any project, preparation is key. And the success of the management standards approach, and we've found this from experience, relies very, very much on commitment. So commitment from senior management and commitment from all the employees and workers throughout. It is an excellent engagement tool, but it's very important that you don't just land a survey on someone's desk, or that ask employees to fill in a survey when you're collecting some data that they don't know what the survey is about. So it's very, very important to prepare that and take that step. This approach that the HSE management standards approach is a 5-step approach. There's 5 steps to risk assessment. So again, the first thing you would be doing would be identifying your risk factors, and those are the 6 standards, which are the demands of people's job, the control that they have. Professor Siobhan O'Neill mentioned about support. Peer support and managerial support are very, very important as well. Relationships, that's more about the culture and ethos in the organisation. Making sure that the role is another standard, making sure people understand what is expected of them in their jobs. Maybe some people's roles have changed now that they're maybe working from home. Maybe businesses, Paul has mentioned as well that maybe some people's businesses have had to change. So again, and change is another big a standard, and sometimes change can't be avoided. But if it's not change is not managed properly, this is when it could lead to work-related stress. So it's not exactly about a particular change, it's actually about the process of change and how that is managed within the workplace. So those risk factors have been identified as the 6 standards. What we would be encouraging in the methodology to do, the next step in step 2, would be actually to survey your staff. So part of this assessment-based approach is really it involves the use of what we call the HSE Management Standards Indicator Tool. So it's really a 35 multiple choice questionnaire that can be issued to all of your employees. And it just really helps you to provide some quantitative analysis of the 6 stressors that we have just identified. So each of the questions are managed around or are worded around the 6 standards that we have mentioned. It's relatively straightforward, folks, for you to complete, but again, its success very much depends on the employee participation and engagement within the process. But it's a very invaluable and early indicator of potential problem areas maybe within your workforce. There's a variety of ways that we can do that. So say, for example, if HSE and I are going to host the survey for you, we can draft up the questionnaire and we'll be working with you. We would then issue an electronic link, which you can issue out to your staff. Now, we recognise that not everyone has access to email, etc., and maybe depending on the industry that you work in, it'd be very important to recognise that obviously to get people to fill in the survey, that we would need to we do have another option for you, which is a piece of software called Quizdom. Now it is a handheld device and people can fill in the answers on that. And again, when it's safe to do so, maybe after the pandemic has maybe ceased or settled down, we would be able to maybe come on site to help you do that. And then there's also the option of the hard copy. So it depends, you could decide to implement this yourselves within your own organisation. This is a free to use resource. All our resources are available on our website. So, but as well as that, it's very, very important to remember not only to go just on the survey information, that you can also use other pieces of data within your own organisation. So if you have done any other surveys, you might have some, for example, staff absence data, staff turnover information. Again, these are other invaluable sources of information in identifying if work-related stress is a problem within your organisation. So you've got the qualitative and quantitative information. It's very important now to take the next step 3 and to get the qualitative information. And the standards would recommend that you would carry out focus groups. And again, evidence would suggest, even for us and experience when we're carrying this out, individual perceptions play a very, very important role in predicting stress-related ill health, and stress is an individual thing as well. So it's very, very important to gather the opinions of your employees, and again, that is encouraging your employees to engage in the process. So we would be recommending conducting focus groups by looking at exploring the problems, but also looking at developing solutions. So focus groups can provide an opportunity for you to explore work-related stress in more depth then. So you've got that information. The next step would be to record your findings and develop your action plan. And then step 5 really would be all about monitoring and reviewing. And basically any monitoring, review and any action will taken to tackle the stress of in the workplace. It's very, very important, but you might find that you might have likely find that you might have some quick wins, but on the other hand, it might take months to pilot maybe a more longer term complicated solution, and then much longer still for something aimed at delivering long term, cultural change within your organisation. But it is important just to remember, even though these 5 steps, it shouldn't just stop there. Really, it's important to remember that this monitoring and evaluation stage should naturally merge into your everyday management practice. So I mentioned about cultural change there already. Sustained changes of that nature will require a lot of effort and a lot of sustained effort at all levels throughout the organisation. So for many of your employers, I know that's a very short, brief snapshot of the actual approach. Some employers might find that a daunting task, but I'd like to assure you that the advisors here and the Mental Wellbeing at Work Advisory Service are here to guide and mentor you through that process. Not only that, we also have run workshops and webinars, and we have numerous resources. We run a workshop called the Managing Work-Related Stress, the Management Standards Approach, and it very much focuses on the practical application or implementation of that management standards process there. And again, it's focused at an organisational level. And again, we've already heard about the line managers and the importance of line managers looking after themselves. We have a line manager workshop, and that workshop provides line managers with the tools for managing work-related stress within their respective teams. It explains how to structure conversations with employees who may be exposed to stress within the workplace. It helps them look out for signs and symptoms, etc. Maybe of employees as well that might be suffering from work-related stress. And then, although we recognise there's certain amounts of pressure are good for you in the workplace for our performance, too much can lead to what we know as burnout and fatigue. And this is a growing area of interest and within the context of our work. So we have actually developed a programme dealing with this very issue as well. And the workshop will enable managers and employers to understand and appreciate the signs and symptoms, again, of burnout and fatigue, as well as understand how to effectively deal with the issue by creating a more resilient workforce. So all those details of our workshops and webinars, etc., are available as well on our website. A lot of us have been forced into working at home, and maybe a lot of us still are working at home. We have also developed a resource called Managing Work-Related Stress at Home. So again, that's just a flyer providing some key points for employees and managers to consider as well. That's very important when people are working at home to make sure that, and I know Mark Durkin had mentioned that earlier, you know, having to maybe homeschool like myself, maybe having to deal with other issues when you're working at home. So that is a resource there. We also have developed a talking toolkit. That's a resource developed for line managers to help them start having simple, practical conversations with employees about issues that could lead to work-related stress. And the most latest thing we have done as well is we have developed a video to help employers fully understand about the issue of stress and be aware of what services we offer. So it's a short presentation available on the HSE&I YouTube site, and it basically just highlights the work the advisory service do and provides an overview of, again, the six management standards and that approach that I just discussed there with you. So again, if you want to find out any more information, please check our website for any of our resources, and as well, even if you want to check YouTube channel, the HSE&I YouTube channel for our video.
Thank you very much, Claire. Is there a URL link for those resources?
I could actually, most of our information will be found on www.hseni.gov.uk, and if you search for events, that will give you all the events that are available, and that all the resources are available in the publications section of our website as well, Paul.
Claire, could you tell us a wee bit more about the new talking toolkit? Because that's something we haven't come across something of that nature before. I mean, there's things that are, you know, like it and resonate with it, but just not quite like that, because of the fact that it focuses on getting employers and employees to talk about mental health. Now, can you tell us a bit more about how it does that?
Yes, of course. So this toolkit we recognise, obviously, that line managers have a very important role for managing work-related stress. So they may be the first point of contact for an employee that maybe is suffering from work-related stress. So this toolkit has 6 templates. Now, and I mentioned the 6 standards, which are the demands, control, support, relationship, role, and change. And these are the key areas of work that can either cause or exacerbate work-related stress. So the toolkit has 6 templates for these 6 different conversations around each area of these standards. So each of these have a different theme kind of designed just to get the line managers and employees talking. And again, it's just to encourage that no one is expecting a line manager to be an expert, but it's just to encourage the conversation and give the employees, the confidence to have that conversation. So they have each a different theme designed to get them talking, and which about issues really that would be causing work-related stress, or issues that maybe even could have the potential to cause work-related stress if they're not managed. So for each conversation, there's a sheet for the line manager with a series of questions, and which can help you start the discussion then with your employees. And the second sheet then helps the line manager develop the solutions and come up with some ideas with the employee then about how to take it forward and tackle, how to tackle the causes of work-related stress. So again, that's available for it's a free resource. You can download it. You don't have to use all 6 of them. Maybe it's only one standard that you might want to use, so you can print that out and just use each of them individually as well with your employees.
That's very useful, Claire. One thing I did want to ask as well is one issue in a lot of our attendees today. We've got nearly 300 people today, and a lot of them are SMEs, small, medium enterprises, and they will regularly say to us at the Commission that, you've got great resources on this or that, but I'm a small business and I might be just 15, 20, 30 people. Now, I'm going to have the same issues as a big employer, but I just don't have the resources and time and that. How do you, what type of service do you offer those employers?
Yes, well, we will help any employer that where we order resources as well permit. What we can do is some of the smaller some of the smaller businesses may not have to go in depth maybe to the process, so we can actually guide and mentor them through the process. Where resources we permit, we can host a survey for any of the employers, and again, we will be encouraging them to go through the full process of doing the focus groups and the action plan, but we will always be there in the background to guide and mentor them as well. All those, we have sample templates. We have which we can give each of the employers. So we have templates for sending out the initial letters. We have templates for example, if we're sending out a letter to employees to complete the survey online. We also have template focus group letters. So we have a range. I think we've 27 some different resources all available there. Some organisations may find it too daunting, so that's where we're here. That's our role, to provide and guide and mentor through the process. But other organisations, maybe if you have the expertise in your own organisation, those resources are there for you to use for free.
Okay, no, thanks very much, Claire. That's very interesting. I do have a question from one of our attendees, and it's directed, I think, at you and also at me. So I'm going to, and I think to some extent you've addressed it, but I would just like to put it to you. Yes. The Mental Health Charter does say that employers should provide training on various issues, and one of those is around health and safety. But the questionnaire says that small businesses are struggling to survive. They don't have the resources to spend on training. So how can you encourage them to provide training when it's potentially going to cost them money? But you have said that to an extent that your training is free, but could you elaborate on that, please? Yeah,
of course. Well, the other thing I probably should have mentioned as well, with regards to training in any organisation is what we would call a secondary intervention. So we would be encouraging organisations to actually have a blend of the primary interventions, which would be your risk assessment, because the legislation says you should have a risk assessment for work-related stress. Training would come under a secondary intervention. Now, you may have an expertise in your own organisation as well that maybe can carry out some of that training. So you should really be having a blend of interventions. You should also have tertiary interventions, because these are more looking at the rehabilitation of an individual. So that could be things like employee assistance programs, etc. So again, these are things that we should be encouraging. You have your risk assessment. You also should have your training, which are helping the individuals with their coping mechanisms, and then tertiary interventions like maybe, for example, your employee assistance programs. So would I be encouraged to do that? We will provide our training for free, the workshops, and if we can help out, we may be able to come into organisations and deliver maybe line manager workshops where we have the resources as well. But again, please feel free to get in contact with the advisory service, and we will try our best to help out.
Okay, and Claire, one sort of final question, and it's a very more basic question. We've been talking about stress, and sometimes you hear the word thrown about, but sometimes we don't think about what are the actual results of stress when people are put under stress. I mean, what have you an experience of that, and what can you tell us about that?
So one of the things about stress is a very individual thing, and again, it's based on individual perception. So maybe what would be, I would feel under pressure or stressed about, and maybe it wouldn't take a fizz out of someone else. But what we need to remember as line managers and as employers, if someone feels that they are suffering from work-related stress, that stress then can become their reality. Maybe you might notice for signs and symptoms of employees that may be becoming maybe a wee withdrawn, maybe not participating maybe in team meetings the way they would. It might be like a change in the behaviour that we should be encouraging employers to look out for those signs and symptoms. With regards to stress, if someone is working at their optimum level for a prolonged period of time, we're all under pressure at times pressure is good for performance, but if you're working at that optimum level for a prolonged period of time, that's when it can start to go into suffering from other conditions and suffering from stress. So it's very important in the workplace, by using the 6 standards, like the demands of the job, looking at people's, their workload, the pace and intensity of their work, and trying to manage those within teams and within your teams, and even the other six standards, about control, the relationships, role, change, and it's trying to preempt these from happening by putting your risk assessments in place. Really, that's what I'd be encouraging employers to do.
Okay, Claire, that is very, very informative. I would say to you, there are other questions, but we don't have time to go through them all. But what we will do is we'll make sure that we put those questions to Claire, and that we'll provide answers to the questionnaires. I would say also that we are recording today's event, so it will be available. And so if you've missed something, or something was mentioned that you didn't quite catch, or you want more information on, you can go back to the video, and of course then you can come and ask us questions afterwards, if that's the case. So Claire, I would like to thank you very, very much. It was extremely useful. And I would say to attendees, go and look at the standards, go and look at the Talking Toolkit. It's quite novel, it's extremely practical, and it really helps employers get a sense of how you can begin that really difficult conversation about mental health and mental ill health, which many of us really fear doing because of the personal nature of it. So Claire, thank you very much, and we appreciate your contribution today.
Oh, thank you for having me, Paul. Thank you.
Not a problem. And so we'd like to move on. Again, in line with what I said earlier on, we want to give you a sense of what practical things you as an employer can do in the workplace to address mental well-being, mental health, etc. And our next speaker is Edith Dunlop from the Northern Ireland Union for Supported Employment. And Edith is going to talk to us about support that's available and good practice in general. And again, if as Edith is going through her presentation, any questions come into your mind, please ask them in the questions function, and we'll put them to Edith. So Edith, you're extremely welcome to this morning's seminar. And we look forward to hearing what you have to say over the next 10 minutes. Thank you.
Okay. Thank you, Paul, and welcome everyone. I'm delighted to be presenting today at this celebration event for the European International Day for Persons with Disabilities. As we all know, this is a very significant year, not just because of the pandemic, but also because we're celebrating 25 years of the Disability Discrimination Act coming into force. And I suppose we very much see a lot of changes, very, very positive changes over the years, but we're still maybe a long way off ensuring full equality for people with disabilities. But we're in the right direction in that way. And also that NIUSE and its members have worked very, very closely with the Equality Commission for many years. And in particular, we're very excited at the moment about our partnership in working on the Make It Work project, which will really promote better jobs for people with disabilities. And you will hear more about that in the coming days, weeks and months ahead. But it's a very exciting project that we've been involved in. I suppose in my presentation, what I want to outline is the support that is available from organisations, available to employers to support the mental health and well-being of your staff. You've already heard from Claire from the Health and Safety Executive about really much very practical advice and resources, and some immense excellent resources that are available there. And you're also going to hear from Una Wilson as well from the Equality Commission and the support that's provided through the Mental Health Charter. And what I really want to stress really from the beginning is that employers, you're not on your own. There are a range of support organisations and programmes that you don't have to deal with these issues on your own. We are all working towards the same aims to provide mental health and well-being for your staff. particularly at this time. As we know, COVID-19 has impacted on all our health and well-being, as well as our livelihoods and our economy. People with disabilities have been disproportionately affected during the pandemic, and many have had to shield or self-isolate, and many people with disabilities have been made redundant or furloughed, and really with uncertain times ahead as well. And it has been a very anxious time for everyone, and it has been detrimental and has impacted on people's mental health and well-being. And now more than ever, employers have a duty of care to their employees to support them through these uncertain times. So what support is available? I suppose from NIUSE's perspectives, we're a membership-based organisation representing disability employment sector that provides support to disabled people to access, stay and progress within employment. Our members cover all areas of disability, and in particular mental health is covered through our member organisations such as Action Mental Health, but we also cover physical disability, learning disability, sensory disability and hidden disabilities. And one of the things that have come through from a lot of our member organisations at the moment is they're also dealing with health and well-being and mental health of their individuals through this time, that it's not just focus on mental health. It's people with a range of disabilities also being affected through the pandemic as well. But one thing as well is that, you know, the organisations are not there just supporting individuals, but they're also there to support employers, help employers to look at their recruitment practices and to get meet their recruitment needs by recruiting people with disabilities, but also helping them to retain their employees. NIUSE's members really provide a range of support to employers across all the business sectors and sizes of business. Whether you're a small employer, large employer or a public sector employer, there's disability support organisations right across Northern Ireland there wanting to help and support you. And as was already noted, we are a very small business economy. And actually, according to the Interdepartmental Business Register for Northern Ireland 2022, 95% of our business employ less than 20 employees. So many of those employers don't have HR departments. This function is usually left maybe to one person. However, small businesses are still very, very committed to supporting their staff and mental health and well-being, and we need to be there to support them through that. The disability employment sector provide in-work support to employers and their employees with relation to mental health difficulties to ensure that they can stay in employment. They provide a range of services and they provide advice and guidance on how to manage mental health in the workplace. They help to identify issues and put forward practical solutions. For example, some have been mentioned today, and things like looking about flexible working, looking at the hours when somebody starts and maybe finishes their work, looking at somebody's workload. Maybe there's certain aspects of their duties that is putting them under stress. Let's remove that and help support them through that. But also maybe to look at aspects that they're working on and are working on very well and explore those further. There's environmental issues as well. We need to look where a person actually is work. Where is their workstation? How do they get to work? Is it stressful and even getting to the workplace? And maybe now more and more people are going to be working from home. Before the sort of pandemic, I know that had been an issue that's been raised by our members that people weren't being able. And overnight that changed, and so many people have been working from home throughout the last 9 months. But I think we need to be careful as well in relation to working from home. It's not just that they're not being supported while they're there. There's a whole big issue in and around the mental health with people working from home that we need to take cognizance of. But also the support organisations provide that one-to-one support to employees through mentoring and confidence building. They can provide that. They can also provide counselling and other therapies such as cognitive behavioural therapies. They can provide training in the workplace as well, mental health awareness training for other employees, for them to gather an understanding of the issues and how it impacts on an individual as well. Also, mental health first aid training as well. Some organisations deliver that. But I suppose really the support from many of the organisations is that if they aren't able to deliver that themselves, they can signpost, and that was something that was mentioned earlier on as well. It's very much about signposting people in the right direction as well. And also providing that ongoing support. And that's something key that we believe within the disability employment sector. It's not just about going in, doing a short fix, but they're there to maintain and work along with the employer and with the individual as well. Also, the supported employment organisations as well will also utilise the government programmes that are available to people with disabilities and people with mental health difficulties as well. And they are delivered through the Department of Communities, and they provide a suite of in-work support for people with disabilities, and actually focus very much too on people with mental health difficulties in work. There's such programs as the Workable NI, which provides a flexible range of long-term support to people with disabilities who face barriers in finding employment. And in employment as well. And that may be a route that you want to look at if it's somebody within your workplace is finding it difficult to sort of maintain their job at the moment, that the Workable programme will come in and support the individual as well as supporting the employer throughout that. So the Workable programme, once again, very similar to what we our supported employment organisations deliver. It's very much about that information and advice. It's about that one-to-one support, about counselling, mentoring the individual throughout that, but also there for the employer. And the employer can be there to ask questions that they may feel uncomfortable about, to ask individuals, so they're there supporting the employer as well. Workable NI is actually delivered through three sponsor organisations in Northern Ireland: Disability Action, Supported Employment Solution, which is a consortium of organisations including Action Mental Health, Cedar Foundation, MenCap, the Now Group, Orchardville Society, RNIB and RNID, and also UCell as well. Now, one of the things we'll do after this through Paul is that we'll be able to circulate the information on these contact details for these organisations as well. Another programme which is delivered by the Department for Communities as well is Access to Work. And Access to Work is very much a practical solution to individuals and to employers. They look at the barriers that are facing people with disabilities in getting into employment, but also in employment. And the Access to Work will contribute towards any additional costs that may arise as a result of that. And they're very much done on a one-to-one basis as well. But it is an excellent programme. It provides support from communication support through to aids and equipment, through to adaptations, but also there's an element, a support element within that as well. And that, I think, in particular for people with maybe affected by mental health or at this time, would maybe very much benefit from. So there's additional support that you can provide, and that support could also be with a co-worker who may be able to give some of their time over to support the individual or mentor or buddy that individual through that difficult time that they're facing. But once again, an excellent programme. We will send the contact details out to you all. And then finally, there's a condition management programme. And the condition management programme in particular as well helps people to manage their health condition. The programme is led by the healthcare professionals such as occupational health therapists, physiotherapists and mental health nurses. And it was really there to help people to look at managing their condition and also then to sort of put in those interventions to help build people's confidence and to look about getting back into work. It was originally set up for those people who maybe were unemployed and to look at how for them to make those steps. It wasn't totally focused on getting somebody back into work, but it was really getting them along the journey to do that. But it also supported people who were on the Workable programme. But now that programme has been expanded. It is expanded now to people who have maybe had to come out of work, who are on the sick at the moment, and also individuals who are maybe in work and are maybe at a stage that maybe don't want to necessarily go off on the sick. So they're that intervention that can prevent from people maybe to losing their jobs as well. So it's a very, very significant programme, and because it's delivered by those health professionals as well, and they provide a range of support looking at how to dealing with stress and anxiety and low mood and depression. It looks about coping mechanisms as well. It looks about relaxation techniques that will help somebody to relax and to build their confidence as well and get them back into work again, or back to look at the work that's there. But as I said, that only recently now it has been expanded now to offer that service to other people. So that's very much about the work that is available there for people in employment. But really, there's another key issue at this stage as well. It's about getting people back into work. And as all we know, the COVID-19 has had a dramatic impact on their economy, and it has affected the amount of people that are now unemployed. And those numbers have increased. So it is particularly important that at this time that as more people are looking for employment, that we need to ensure that disabled people and people with mental health difficulties are given the same opportunities to get into employment. So that's another key area that the supported employment organisations and our member organisations can help employers with. It can help them to look at their recruitment practices to ensure that they're including people with disabilities. They can help provide information and advice about reasonable adjustments and positive action, and that's something that we've worked very, very closely to with the Equality Commission, ensuring that best practice within taking positive action. And some of those will include, for example, some of the health sector there recently provided some pre-employment training for people with disabilities to get into employment. And it was a 12-week program that looked at the skills and some training and some work experience during that time. And then at the end of that period of time, they were given there was a guaranteed interview, and it was very, very successful. Over in one of the health trusts, in the Belfast Health Trust, over 9 people were able to secure paid employment at the end of the training. And also that's been conducted too in the Northern Trust area as well, which was really provided that opportunity for people to get back into work again. So there's a number of things that employers can do in relation to taking positive action, and those are just a few of them, such as the pre-employment training, such as guaranteed interview. But one that we would often ask employers to also to look at is maybe about the potential of ring fencing posts for people with disabilities. And you can do that under the Disability Discrimination Act to ring fence posts, which will really secure those employment opportunities for people with disabilities as well. Organisations like NIUSE and our members can also help with looking at person specifications and job descriptions as well to ensure that they are open to all people with disabilities. Another key area that that we bring to help support employers is really looking at the candidates that are going forward for jobs. NIUSE, we can circulate any employment opportunities that are available, and the supported employment organisations will look at the criteria that the employer is looking for and match those to the individuals that they're working with. The supported employment organisations are working with individuals. They know their skills, they know their abilities, they know the areas of work that they're interested in. So they're going to try and make that good job match. And we've seen very, very many successes with working with a large number of employers and making that good job match and getting somebody into work. And really by widening your recruitment pool as well, is really you're ensuring that you're getting the right person for the job. And people with disabilities are very, very eager to get into employment and have the skills and the abilities to do those jobs. So please, every opportunity that to look at sort of ensuring that you're employing people with disabilities, particularly that when during this pandemic as well, as we all know. So really, I just would really like to end by saying as well that, you know, really there's so many opportunities there. We're really trying to encourage employers to contact the organisations. We've heard today, as you know, from what's is available through the Health and Safety Executive. We also know through the Equality Commission, through the disability organisations, through what is being provided by the Department of Communities as well. So we would really encourage employers to contact us. And I know sometimes it can be difficult as well, navigating who to contact, what are they going to be able to provide for us. So one of the things that we would very much encourage employers is to contact even the Northern Ireland Union of Supported Employment, and we will try and help to navigate you in those right directions as well. Because it's really, as we're all working there to support you as employers and to support the individuals and ensure that more people with disabilities and more people with mental health and wellbeing are being supported within our workforce. So thank you.
Edith, that was very informative. Thank you very much. And I actually did have several questions for you from the speakers, particularly around positive action, and you answered it. So just to reiterate, speaker or attendees were asking about the legitimacy of using positive action to ring fence posts, and we agree with you from the Commission's perspective It's one thing we encourage employers to think about seriously in terms of disability, is to ring fence posts for disabled people, and at least to consider introducing guaranteed interview schemes, but not just in isolation, because as you say, they have to be supported by support measures. It's not enough just to offer an interview. There have to be support measures that back it up, that make it meaningful. But one question that we would put to you, and briefly, if you wouldn't mind answering it, because just to keep ourselves on time, is could you tell us briefly about the Make It Work initiative?
Yes, definitely, Paul. The Make It Work initiative is really a partnership between the Equality Commission and NIUSE and its members, and I suppose it's really about providing information about individuals and sort of what their success stories are within employment. So there's a series of videos which that the Commission have pulled together to look at what support is available to people and get into employment, but also that I suppose really what really enriches this is the case studies that they've been able to identify, and the case studies themselves are really people's lived experiences of people with disabilities as they've got into employment. And there is a specific focus as well in relation to sort of COVID-19 as well, because it really highlights how people throughout COVID-19, people with disabilities throughout COVID-19 have been in employment and have continued to be in employment and continue to deliver those real essential roles and key worker roles as well. So we do have a number of case studies, which some are available on the website, and I've just heard this morning as well that the Belfast Telegraph is carrying a number of those case studies as well, and those case stories really provide go through that sort of journey of somebody getting into employment and their experience, but also hearing from employers and then talking about how they have found the experience as well and how they value very much the contribution that people make. And actually, just one of the individuals that are that I just love their story, to hear what their story is, as a person now, Leslie, who works in ASTA. She has actually worked as a picker, for orders for people with bringing deliveries. Sorry about that. And as we know, through the pandemic, that was really key for a lot of people to be able to get things delivered. So she would actually, her role was to come in the morning when the place was a little bit more quieter to do this. But during the pandemic, she was getting up, she was going to work at 2 o'clock in the morning to go in and to do her job to ensure that people were getting food, when those orders were out. So I think, we forget throughout this pandemic that we often think of people with disabilities and them having to shield and self-isolate, and they have been able to, but there's been people with disabilities who've been working throughout this period of time as well. And we also hear their story, the lived sort of experiences as well during that we've a gentleman too, Ben, who set up his own business during the pandemic, selling supplements, and he's been supported through the Cedar Foundation, as well as Leslie now, who is supported through Triangle Progression to Employment as well. We've also got a person, Hazel, who is a person who's worked throughout the pandemic as well with the Public Health Agency, and she's been supported by RNID as well. So there's five or six case studies as well. We've got Colin from Disability Action, and he is actually working in Disability Action now, but he has, previous to this, he was a participant on the programme and now is delivering the programme to other people with disabilities. So it's a real sort of unique story there as well. So it's definitely worthwhile linking in and hearing about the journeys that people have been through as well.
Edith, that's great. And the stories are being made available today, as you say, and they'll be available on our website, and we're able to share those and talk to employers about them, and they will help inform employers about what they can do in terms of encouraging greater levels of employment for disabled people. And thanks very much, Edith. And again, for your overall contribution, very informative, lots of information, and people asking for some of the links that you refer to, Edith, and we'll make those available to people, to the attendees. And thank you, Edith. We really appreciate your contribution and for spending the time with us this morning.
Thank you.
And we're moving now on to a final speaker today, and that's my colleague Una Wilson from the Equality Commission. Una and I work together in the Advice and Compliance Division in the Advisory Support Team. And Una's going to talk to you about the support that the Commission can offer. And I would just note before I hand over to Una that we have had a number of questions about how the Commission can support employers. And we also had a question from an employer to say that, you know, it's great that the Commission can do training, etc. But again, this employer doesn't have money to spend on training, so they're not able to afford the training that the Commission and others offer. So there's some issues there for Una to address, and lots more. So I'm going to hand over to Una for the next 10 minutes. And if you have any questions for Una or the Commission during Una's talk, please record them, and I'll put them to Una at the end. Una, you're very welcome, and over to you.
Good morning, Paul, and good morning, Edith and Claire, and very welcome to the Mental Health Charter. I'm going to be taking you through how the Equality Commission can support employers in the context of the Mental Health Charter. And my role in the Commission is to provide advice and information along with my other team members in terms of advice on how to implement the Mental Health Charter, but also in terms of signposting. And you've heard from all the previous speakers about the importance of signposting. And I suppose that's really crucial. Paul there addressed an issue around training. Both the Labour Relations Agency, the Health and Safety Executive, and the Equality Commission, who are all partners in the Mental Health Charter, provide free training for all organisations. So it is crucially important. Before I actually go through the partners in the Mental Health Charter Partnership Initiative, I just want to kind of, I suppose, bring together what a lot of other speakers have been talking about, and both our Chief Commissioner and Siobhan, the Interim Mental Health Champion, have identified a lot of the statistics in terms of issues, but I just want to bring back to the equality issues in terms of, and Lancet, the medical journal, has carried out research to look at the levels of mental health before and during the lockdown. They assess certain groups are experiencing more distress during the pandemic, particularly women, young people, and preschool-aged children. As the economic consequences of lockdown develop, when furlough turns to redundancies, mortgage holidays expire, and recession kicks in, they have suggested it is reasonable to expect not only sustained distress and difficulties for people, but also to look at the levels of anxiety of individuals within organisations. And in particular, the mental health charities have identified anxiety has increased from 21% in 2019 to 37% now. I'm going to refer back to the Stevenson Farmer report, which was the government report, the UK government report into mental health across employers and across employers in the UK. And in the Stevenson and Farmer report, they identified that over 300,000 people in 2017 had lost their jobs because of mental ill health. And that's the population of Belfast. So I'm going to refer back to what the Equality Commission can actually do in the context of helping you get your policies right and your procedures right, and looking at your practices in terms of those issues. I'm going to move in through the actual mental health charter, and I've been very fortunate to be involved in this project from the very inception, where we sat down and we worked with the mental health charities and Disability Action to look at a practice-based approach. And we preceded the Stevenson and Farmer report because we launched in 2016. So all the commitments in the charter and the action measures are all based on that evidence-based issues of working with people with disabilities, and in terms of mental ill health, in terms of what sort of support and what sort of support employers need. And obviously our other three statutory agency partners are the Health and Safety Executive, the Labour Relations Agency, and the other organisation that works alongside us and provides very useful research issues in terms of mental health is the business and the community. And we're moving on to the next slide. The Mental Health Charter is a voluntary charter, because a lot of organisations, when they sign up to the charter, do I have to do every action measure on the Mental Health Charter? No, you don't. It's very much built on the basis, and Edith referred to the fact that a lot of organisations are small businesses and they don't have the time or the money to invest in a lot of HR practices like wellness action programs and things like that. And they need to tap into local procedures that are available. It's designed to be put together as a puzzle which fits organisation size and nature. So don't have to fit every single action measure before you sign up to the charter. It is about voluntary training and information, and we've already talked about the signing, but another aspect of the charter which is crucially important is about sharing good practice. And that is a primary role of the Mental Health Charter, is to highlight the good practice that organisations, and it has been a considerable time of change, and HR has had in large organisations, and small business owners have had to adapt very quickly in terms of the way in which they support their employees in the organisations. If you want to sign up to the Mental Health Charter, you can sign up on our website, and there isn't any questions on that. That's just a simple sign up process. Moving on to the next slide. The charter commitments are to create an open, inclusive workplace culture which displays respect for those with mental ill health. Crucially, that is a really important issue for a lot of organizations in terms of looking at when organizations sign up to the Mental Health Charter, they say, what's my first step? And you explain to them that it's important to collect the data. And Claire has already referred to the stress audit that the HSE can help you with free of charge. So some of the employers who signed up to the Mental Health Charter have combined the stress audit with their investors and people, or they have included it as part of their engagement policy. So that might be for the larger organizations. The smaller organizations might want to adopt a different approach. In terms of some of the issues that, in terms of the way, and the important part of this is leadership, and organizations that have had leadership and have approached this issue in terms of looking at the leadership issues have found it quite useful in terms of looking at what are crucial to in terms of getting organizations to sign up to the charter. Now, the Equality Commission in particular can help with Commitment 2 and Commitment 3. And if you go onto our website, this is an interactive PDF, and the action measures are actually laid out in a booklet like this, and you'll find them in the charter section in the website, okay, in the employer section. The key part about promoting equality of opportunity and challenging discrimination in the workplace is about reviewing recruitment procedures, reviewing procedures in terms of bullying and harassment, reviewing procedures in terms of individuals in terms of promotion strategies, but also in terms of assessing people in terms of their performance, in terms of performance management. And crucially, one of the things we've identified in, and I'm not going through the DDA in any detail this morning, but the context is have you looked at your bullying and harassment policy in the context of COVID? Have you looked at how people with mental health are treated in terms of approaches by managers in terms of issues around bullying and harassment, but also in the context, and I am very much saying this in the context of getting balance, because there is a whole issue about looking after the wellness of your managers as much as your employees, and it is crucially important in terms of those issues. Edith referred to the positive action measures, and they're actually contained in the section commitment on section 3 of the charter, and you'll find those all link in terms of those issues. And then identifying and providing support, and if any of you are service providers, it is about, we have another initiative called Every Customer Counts, where you can look at positive steps to making services accessible to people with mental ill health. The Charter actually mirrors the commitments that were in the Stevenson and Farmer report to produce and implement a mental health at work plan, to develop awareness. So in the creating an inclusive workplace culture, one of the first things you can actually do is to sign up to the anti-stigma campaign, which is run by one of the partner organisations, Inspire. And you can also look, and when Siobhan was talking, she was talking about conversations and having conversations. And when you talk to employers on an ongoing basis, they find the difficulty of having that conversation about mental health. And there is excellent videos on all of our partner organizations website that you can access in terms of having those conversations, but also referring back to the fact that Claire has already talked to you about the stress management conversations that you can have in terms of those issues. Moving on. How can you support staff working from home or at home or at work? And I suppose this is the key question. Organizations have developed numerous programs in terms of looking at changing the way they do their wellness action programs. And we've noticed that in particular, organizations have some of our signups, there's over 200 of them, have done online horticulture sessions, or they've done online information about managing your stress. Organizations have provided well-being programs like physical well-being programs and things like that. In terms of looking at those issues, how can the Equality Commission help? We can help you review all those policies, as I was already explaining in the context of the commitment. But we can also help you look at the practices. Through our inquiry line, you can ask for advice and information on those issues, and all of that is free of charge. Examples from across Northern Ireland in terms of good practice. So for instance, one of the organisations, and I suppose this is crucially important, when the Stevenson and Farmer report looked at investments in mental health and whether you would get a return on investment, they said for every pound you got a £4 return on investment in terms of mental health if you made changes. Deloitte did a further report on this, and they said for every £5, for every £1, you got a return of £5 2 years later. In terms of our own employers in Northern Ireland, one of the organisations, which was a large manufacturing organisation, actually said that their productivity went up by 2 to 3%. So by sharing good practice examples, and Edith talked about in terms of employer support, and a lot of the times in terms of, especially in the context of keeping people with mental health, looking at redundancy issues, looking at probation, looking at issues in terms of managing individuals with mental ill health in the workplace. The support that's available through the supported employment organisations has been identified, and we have a number of videos where you can actually look at those in terms of good practice examples. So let's work together in terms of sharing good practice and looking at those issues. I'm going to finish because I think it's appropriate. I do want to remember the fact that the theme of Mental Health Week this year was kindness, and it is crucially important. When the Equality Commission started this work, we noticed that there was negative attitudes towards people with mental health in the workplace, but also in terms of neighbours. And we all live in a community where work or access to work is crucial for good mental health. And employers in Northern Ireland are doing great work, but we need to showcase it more. The quote I'm finishing with is from Marie Curie, which I think is appropriate in the context of the vaccine. Nothing in life is to be feared. It is only to be understood. Now is the time to understand more so we can fear less. So in terms of mental health, asking the questions, contacting the Equality Commission, and we'll guide you through on a one-to-one basis in terms of the Charter, but we'll also work with you in terms of showcasing that good practice so that we can show more examples of good practice. And I'm going to finish with a tiny little story, and I know I've gone over time, and my apologies, is that one of the good practice examples Edith was talking about was there's a young woman with mental health, and she worked alongside Action Mental Health, and she did a number of courses in terms of resilience, and she applied through open employment to a job and got a job fairly recently. So it gives you an opportunity to look at the fact that these stories become reality, and the reality in any community is that they provide help. Some of the employers that have fed back to us have said by having the mental health charter, it's raised awareness of mental health to have those conversations, and that individuals have reached out for help at key times and crucial times in the context of this issue. Thank you very much for your time this morning.
Great, thank you very much, Una. And even though we're from the same team, I have to say that was very informative and very useful. We have promised all of you that we'll finish by 11:30, but I have one quick question for you, Una, that cropped up, which is, and it's kind of not on the topic really of what we're talking about, but it's an interesting question, and it concerns mental health first aiders. And we have a minute. Do you think in sort of a minute you could tell us a bit about what are mental health first aiders? What do they do? What's their role?
Their role is really to signpost, but to be alert to issues. So one of the organisations we worked with used mental health first aiders. Quite a number of the organisations have used mental health first aiders. So the individuals are not expected to be experts in mental health. They're not expected to have skills of a psychiatrist or an occupational health. But what they can do is listen, and by listening, we can change the dynamic, and we can actually, and the example that was given to me by a public sector body was the mental health first aiders noticed an individual had been off sick, went to meet him on his first day back to work, had a conversation with him when he was off sick as well, about the new changes in their organisation by signing up to the charter. And also the fact that mental health first aider will signpost the person to the relevant, either the employee assistance program that the organisation has, or to other charities which might have special expertise in terms of mental health. So they're almost like I suppose what you would call almost like a harassment advisor in a lot of organisations in that context.
That's great, Una. Thanks very much for that. That's very, very useful. And Una, again, thank you very much for your contribution this morning. And I think it molded very nicely into the presentations that we got from Claire and Edith. So that brings us to the end of this morning. Other than what I would like to do is to thank all of the speakers. I'd also like to thank my own colleagues who were behind today's event. I'd like to finish then by just simply saying to you that the event is recorded. It will be available. There are links that people have asked for, which we will provide you with, and we will go back to many of the questions that were asked that we didn't get a chance to address. And to finish by saying that from an Equality Commission perspective, as Una alluded to there, we have lots of guidance and advice on our website. We have a confidential inquiry line, and we have a team who are several teams, professional teams, who will be able to give you one-to-one advice. If you decide you want to sign up to the Mental Health Charter and undertake the process that Una mentioned, we can offer you one-to-one support in doing that from one of our dedicated officers. And you will then access the training, which is free, that Una mentioned as well. So again, thank you all for attending. We would urge you to fill in the evaluation form, and if there is any other information that you want or you require, you would like, please put a note on the evaluation form and we will make sure you get the information. And contact us, and don't hesitate in contacting us or any of our partner organisations. We would be delighted to help you. So thank you very much, and we're now at the end of the session, and I would like to thank you all for attending and urge you to attend future events that we organise. Thank you very much.